Thursday program. I'm Cheryl Johnson Ransaw, Director of Employee Development and Wellness Services at Georgia State, joined by Tony Pelota, our Health and Wellness Coordinator. And we are very pleased to host today's session as we kick off the month of September, recognizing Suicide Prevention Awareness Month. We know this is a topic that is extremely important, sometimes difficult to discuss, but we are delighted today to be hosting a guest speaker, Dr. Chrisanne Mayer, who is the coordinator of urgent care and suicide prevention in the Division of Student Success at Georgia State. And she will be sharing some extremely important information about this topic, as well as resources for employees as well as students. Just a couple of housekeeping items. Our session today will be recorded, and we invite everyone to use the chat box. If you have any questions or concerns or comments, we will monitor the chat box throughout the session and certainly address any questions or concerns before we wrap up today's session. If you experience any audio challenges hearing us, we certainly apologize in advance for that, but just again, give us that information in the chat box and we will monitor that as well. Please note that as a follow-up, we will be sending the PowerPoint presentation to everyone, including a survey to invite your feedback. So without further ado, I am pleased to introduce Dr. Chrisanne Mayer, our guest speaker for today.
Good morning, everyone. Thank you for inviting me, Cheryl, to present today on this really important topic. I spend a lot of my time, other than seeing students in the counseling center, working on suicide prevention and suicide prevention programs. So I'm really happy to talk with you today. We will spend a little bit of time just talking about the problem of suicide and the prevalence. We'll talk about some signs and symptoms that you might see in someone who is at risk for suicide and how to identify those. We'll talk about how to talk with that person that you're concerned about, and then resources that are available to help anyone who is considering suicide or is in crisis. So first of all, just getting a picture of what suicide means to us here in the United States. In the year of 2020, we had almost 46,000 deaths that were as a result of suicide. That means that there's about one death per every 11 minutes. And on average, that is about 130 people per day who die by suicide. Getting a little further into the problem, the number of people who think about or attempt suicide is even higher, of course. Going back to 2020, we had an estimated 12.2 million Americans seriously think about suicide, 3.2 million who planned a suicide, and 1.2 million who attempted suicide. Those are big numbers. It's really, when you think about it like that, difficult to imagine living our life without being touched in some way by the concern of suicide. Just a little about students. Sorry, there we go. Our college students and how they're touched by suicide. Suicide is the second leading cause of death among college students, only topped by accidental death. And for us in the counseling center, about 25% of the students who come in for their first visit report that they've seriously considered suicide. So it's definitely something that we have a high concern about here on campus. When we think about who's at risk for suicide, there are some indicators that we can know about and be on the lookout for. Thinking about feelings, feeling empty, feeling hopeless, trapped, or feeling like there is no reason to live. Feeling extremely sad, quite anxious, agitated, or even full of rage. And feeling unbearable emotional or physical pain. Those are all feelings that if you hear someone talking about and expressing, they should get you thinking about what their challenges are and are they safe. We can also notice changes in behavior. Definitely making a plan or researching ways to die is a big indicator. Social withdrawal, saying goodbye to people, giving away important items, or making a will. Those are all indicators that this person might be at risk. Things like taking dangerous risks, displaying extreme mood swings, feeling happy one minute and sad the next, eating or sleeping more or less in a significant way, and use of drugs or alcohol more often. All should make us a little more concerned and perk up our ears to listen more. Sorry, I'm having a little trouble getting my PowerPoint to advance. There we go. So then there are some situational concerns, things that happen in our lives that put us at more risk for the contemplation of suicide. Big things in our lives like being fired or being expelled from school, having a recent unwanted move, or the loss of a major relationship, the death of a spouse or a child or a best friend, especially if this death was related to suicide, having the diagnosis of a serious or terminal illness, experiencing the sudden and unexpected loss of freedom or fear of punishment, anticipated loss of financial security, the loss of a cherished therapist or a friend or a counselor or a teacher, and then the fear of becoming a burden to others. All of these make it more of a concern that we might be thinking and paying attention to our friend and the possibility that they might be thinking about suicide. There are some things that go in our favor to protect us from being at risk for suicide. And those are having good relationships with friends, being someone who seeks help when they need it, lacking access to means to carry out suicide, lacking access to firearms, large amounts of medication to overdose on, having the access to mental health care, being religious in some way, and having a work environment that encourages help seeking and promotes health. Those all help to protect us from feeling the suicidal. So when we notice some of these things, some of these feelings, behaviors, and situations going on in our loved one or friend, there are some things that we can do to help them. And the first one is just to simply recognize the warning signs. Becoming aware of what those warning signs are and watching for those in people that we know. We know that typically in the week prior to someone making an attempt, they do let someone know in their life that they are contemplating suicide. So it is definitely something that we can watch out for. And then if you do notice some of these risk factors, definitely reach out and ask, are you okay? If you're in doubt about it, if you're thinking that it's a possibility, but you're not sure, don't wait. Go ahead and ask. When someone reaches out, it does show caring and it helps the person reduce their feelings of isolation and encourages them to share with us. So it really opens up the communication to go on and ask that question. And if you can be direct, ask about suicide specifically. You can ask, have you ever had thoughts of suicide? Sometimes it's a little difficult to get this question out, to be so direct. And so you can sometimes ask a more general question, like, what do you think of people who kill themselves? Opening the conversation up in this way can allow you to talk about suicide in a way that you might not have been able to before. I apologize, my PowerPoint is lagging again. There we go. So, you've asked them the question, you've talked about what's going on, gotten a little bit of information about how the person you care about is doing. And you've gotten some idea now of whether this is a crisis, whether this is something that needs immediate attention. And if that is the case, we definitely do not want to leave that person alone. Want to make sure that they have someone with them at all times. And you want to continue to listen to them and offer hope. Oftentimes, a person who is experiencing suicidal thoughts really are feeling quite hopeless. And so, the more that you can offer them that there is a potential solution that does not involve suicide, the more hope that they can begin to gather. So if they're not at immediate risk, continue to listen to them. You might say something like, I know how strong you are. I've seen you get through hard things. I think we can get through this together. Letting them know that you're in it with them can go a really long way toward them grasping onto some hope. And then you want to have your resources ready. There are a number of resources that you can explore together. And it's really important to know that you are not alone as you're supporting your friend. So you having those resources and being confident in them is very important. So here are some of the supports that are available to everyone. You can call, text, or chat 988. This is the new suicide prevention lifeline number that started July 16th. It's brand new. It will connect you with the local crisis intervention center and with counselors who are expert in helping with such crises. You can also text home to 741-741 and a trained counselor will chat with you. And then from anywhere in Georgia, you can call the Georgia Crisis and Access line at 800-715-4225. The beauty of this access line is that wherever you are in Georgia, they can send a counselor out to you in person to talk with your friend and to assess them and to help them with resources. Certainly, if you're feeling like this is an immediate crisis and you really need some immediate help, you can always visit your local emergency room. And then if you're helping a student here at GSU, the Counseling Center always has a counselor available. We are in the Care Center at 207 Dahlberg Hall. You can come there on the Atlanta campus to be seen in person. You can also call us at 404-413-1640, and that will enable you to talk with a counselor and let them know that you need some immediate help. And that's for all campuses, that one central number. There are a couple of suicide prevention programs that we offer here at Georgia State. One of them is called QPR, Question, Persuade, Refer. And this is an in-person course. It's a 90-minute course. It teaches you more about the signs of mental health distress, teaches you more about how to have this conversation with your friend, how to help to ask the question, how to help to continue the conversation, how to talk with them about getting help, and then how to assist them with accessing that help. And you can see that we have a number of sessions planned for this semester across all of our campuses. And if you're interested in registering to attend one of the QPR sessions, you can go to our Counseling Center website under the Crisis Consultation tab, and you will see the information for our QPR sessions. There's also an online self-guided course called Cognito at Risk Mental Health. This course takes about 30 to 45 minutes to complete. It can be done in multiple sittings, and it saves your progress if you do go and come. It's designed to help learn to notice more about the signs of distress, to use techniques to discuss your concerns, and if necessary, to refer students to appropriate resources. And the Cognito Mental Health is more oriented toward working with students, whereas the QPR is a general suicide prevention program. So to access the Cognito program, you would go to cognitocampus.com, create a new account, and then follow the prompts to enter your enrollment key, which is GSU employee. Then you would follow the on-screen instructions to select at-risk mental health for faculty and staff and launch the program. You can also find information about the Cognito course on our Counseling Center webpage. In addition to the in-person QPR trainings, the University System of Georgia's Mental Health Initiative is offering QPR on a virtual setting. They have more than 15 trainings set each month. Again, it's an hour-and-a-half training. And if you're interested in accessing the QPR virtually, you could use the QR code here and access that training. They also offer mental health first aid virtually. That's a 6-hour course that teaches you more about the concerns about mental health. It teaches you about symptoms of anxiety disorder, symptom of depression, symptoms of substance use disorder, and teaches you more about how to intervene with those concerns. And they offer 2 of those trainings each month. Again, you can use the QR code, or you can go to the link that's noted here, usgsurveys.usg.usg.edu. So that is my portion of the presentation. I hope that you have gotten some good information, and I can't see the Q&A. I can't see if there's anyone who has noted anything of concern or any questions. Can you help with that, Tony or Cheryl?
Yes, no questions right now at this moment, but yes, please utilize the chat if you have any questions.
Well, thank you, Dr. Mayer, for providing that important information and long list of resources that you identified for employees as well as for students. Want to just take another minute to pause and invite any of our attendees, if you have comments or questions, certainly feel free to enter those comments or questions in the chat feature. In keeping with today's topic, and our focus has truly been one of launching a campaign, if you will, to help in the stigma that's really been associated with mental health and just discussing the general topics around mental health. But we know truly it is important, and particularly as we recognize this theme today of suicide prevention awareness, we certainly appreciate having an opportunity to share information and wanting to provide some additional resources that are available for Georgia State employees as well as dependents. So in addition to those that Dr. Mayer referenced, hopefully as a reminder to some, but to others, if you're not familiar with some of the campus resources, in our Office of Employee Development and Wellness Services, we do coordinate an internal employee assistance program called Faculty and Staff Assistance. And so this service is targeted for Georgia State employees, eligible dependents, and we do serve retirees as well, offering confidential consultations and assessments and referrals. There's information on the screen that's available, and as I mentioned, we'll do a follow-up to provide these slides to everyone, so you don't have to be concerned about noting it. But because of the nature of the services, which really are available to address any and all kinds of personal and or work-related concerns, certainly as it relates to any kind of urgent or crisis-related matter, such as being concerned about someone in distress or yourself. We want people to know that the services may be accessed 24 hours, 7 days a week. In addition to this internal campus resource for all institutions in the university system, KeyPro is the external employee assistance program provider offering confidential consultation, short-term counseling, and assessment and referrals. And this is a service provided at no cost. Certainly, services may be accessed 24 hours, 7 days a week as well. There's information provided on the screen for how to reach out, either calling directly as well as visiting the website. And we recognize there may be some attendees who are representing other institutions, maybe outside of Georgia State's campus. So just in consideration of that, certainly if you are interested in identifying other resources on your campuses or just have concerns or questions, feel free to reach out to us as well in our office. Today, we are wrapping up this portion of our program presentation, but every first Thursday, we also offer monthly health screenings. And so we just want to mention to everyone that this afternoon from 12:30 to 2:30 on the Atlanta campus, we will be providing blood pressure screenings in partnership with the School of Nursing, and certainly invite those of you who have the time to consider stopping by and have an opportunity to gather some information on our other services and programs as well. And last but not least, just wanting to also provide additional information on how you may contact our office, EDWS. And so there's information available. We are based on the Atlanta campus in 75 Piedmont, and certainly invite you to visit our website too for information, but always feel free to either email or call if you have questions or would like additional information. And on that note, certainly again want to just thank everyone for attending today's session. Would like to thank Dr. Mayer again for providing this very important information and serving as our guest speaker.
We do have a question at this time. The question is, what is the percentage of suicide rates based on gender?
Male suicide is definitely higher than female. The research shows that females do make more attempts, but males tend to use methods that are more fatal, and so they do end up completing suicide more than females.
Any other questions, Tony, that you see in the chat box?
Nope, looks like that was the only question right now. So thank you for answering that.
Absolutely.
All right, well, thank you for that question. And again, thank everyone for attending today's session. We appreciate you joining us, and look out for our follow-up email, including a short survey. We always want to invite feedback, and certainly if you have comments, suggestions, we solicit for other topics of interest, or how you feel about the topics that we are presenting. We welcome that information as well. And Dr. Mayer, thank you again. And without further ado, we will close today's session. Just encourage everyone to take care and stay well.